Hi, welcome back to our channel. Join me in this educational video as we discuss the importance of getting the flu vaccine right now.
With flu season approaching, it's essential to understand how the vaccine can protect you and your loved ones from the potentially severe consequences of the flu virus. We dive into the science behind the flu vaccine, debunk common myths, and highlight the key reasons why vaccination is vital for community health. As we enter flu season, protecting ourselves and those around us is more important than ever by getting the flu vaccine. The flu vaccine is crucial in preventing the spread of influenza and its potentially serious complications. Not only does it protect individual health, but it also plays a vital role in safeguarding public health. Each year, millions of people are affected by the flu, leading to hospitalizations, missed work or school, and even death. You can significantly reduce your risk of getting sick and experiencing these negative outcomes by getting vaccinated. Additionally, getting the flu vaccine helps to create herd immunity, which is essential in protecting those who are unable to get vaccinated, such as young children, elderly adults, and individuals with certain medical conditions. For example, during 2019-2020, the last flu season before the COVID-19 pandemic, flu vaccination prevented an estimated 7 million influenza illnesses, 3 million influenza-associated medical visits, 100,000 influenza-associated hospitalizations, and 7,000 influenza-associated deaths. In addition to protecting yourself and those around you, getting the flu vaccine also helps to prevent the spread of the virus in the community. When more people are vaccinated, the likelihood of a flu outbreak decreases, ultimately reducing the burden on healthcare systems and preventing the spread of illness to vulnerable populations. It is important to note that the flu vaccine is safe and effective. While it may not provide 100% protection against the flu, it can help to lessen the severity of symptoms and reduce the risk of complications. The vaccine is recommended for everyone over the age of 6 months, especially those at higher risk of complications, such as pregnant women, young children, older adults, and individuals with certain medical conditions. What are the benefits of flu vaccination? There are numerous justifications for yearly influenza flu vaccinations. The first benefit is flu vaccination can keep you from getting sick with flu. It has been discovered that the flu vaccine can lower the likelihood of needing to visit a doctor by 40% to 60%. The second benefit is flu vaccination has been shown in several studies to reduce severity of illness in people who get vaccinated but still get sick. According to a 2021 study, persons hospitalized with the flu who received vaccinations had a 31% reduced risk of flu-related death and a 26% lower chance of admission to the intensive care unit, ICU, than those who did not. The third benefit of flu vaccination, hospitalization related to the flu, can be decreased with immunization. The fourth benefit of flu vaccination is an important preventive tool for people with certain chronic health conditions. People with heart disease who have received the flu vaccination have been shown to have reduced rates of certain cardiac events, particularly if they have experienced a cardiac event within the previous year. The fifth benefit of flu vaccine during pregnancy helps protect pregnant people from flu during and after pregnancy. Numerous studies have demonstrated that a flu vaccination administered during pregnancy not only helps pregnant women avoid contracting the virus, but it also shields the unborn child from the flu for several months after delivery, when the child is too young to receive a vaccination. The sixth benefit of flu vaccine can be life-saving in children. According to a 2020 study among youngsters aged 6 months to 17 years old, flu vaccination decreased hospitalizations related to the virus by 41% and ER visits connected to the virus by 50% during the 2018-2019 flu season. So many people, especially parents, ask how this flu vaccine works. The way the flu vaccine functions is by preparing the body to identify and fight the influenza virus. Here's a thorough examination of its mechanisms. The first question is, what are the types of vaccines? There are various flu vaccinations on the market, such as inactivated influenza vaccination, IIV. This vaccination comprises killed viral particles and is administered via injection. The flu cannot be brought on by it. Another type of vaccine is live attenuated influenza vaccine, LAIV. Suitable for healthy persons between the ages of 2 and 49, this nasal spray vaccine contains weakened live viruses. Lastly, recombinant influenza vaccine, RIV. This vaccine does not require the use of the actual virus because it is made utilizing recombinant DNA technology. Another action of flu vaccine is to stimulate immune response. When vaccinated, the body's immune system recognizes the inactivated or weakened virus as a threat and produces antibodies. These antibodies remain in the body, ready to fight off the actual virus if encountered in the future. This process usually takes about 2 weeks after vaccination. Protection against multiple strains. Each year's flu vaccine is formulated to protect against the most common strains of the virus. The World Health Organization, WHO, monitors circulating strains and recommends vaccine compositions annually, enhancing the vaccine's effectiveness. Who should get a flu vaccine this season? The flu vaccine is recommended for nearly everyone over 6 months of age. Here are specific groups who should prioritize vaccination. Number 1, priority are the children. Serious flu complications are more likely to occur in young children, particularly those under 5. Getting vaccinated protects both them and everyone around them. Number 2, pregnant women. The vaccine is safe for expectant mothers and guards against problems from the flu for both mother and child. First or second trimester should generally not get vaccinated early in July or August because protection may decrease over time. Number 3, elderly adults. People 65 years of age and older frequently have compromised immune systems, making them more vulnerable to serious flu-related illnesses. Getting vaccinated can reduce this risk. Number 4, people with chronic health disorders. Since they are more likely to experience major consequences, people with chronic health disorders like diabetes, asthma, or heart disease should get the flu shot. Number 5, healthcare workers. In order to safeguard both themselves and their susceptible patients, those who work in healthcare environments must get immunized. When should I get vaccinated against flu? September and October are usually favorable dates to get vaccinated against influenza for most people who only need 1 dose for the season. By the end of October, vaccinations should ideally be obtained by all. Does flu vaccine work right away? No. Antibodies that offer defense against influenza virus infection require around 2 weeks to develop in the body following immunization. Hence, it is advisable to have vaccinations prior to the onset of influenza viruses within your community. Debunking common misconceptions about the flu vaccine. Misconception 1. The flu vaccine causes the flu. Many people believe that receiving the flu vaccine can actually give them the flu. This misconception is rooted in the idea that the vaccine contains live viruses. In reality, the flu vaccine either contains inactivated, killed viruses or a recombinant version of the virus, neither of which can cause the flu. Some individuals may experience mild side effects, such as soreness at the injection site or low-grade fever, but these symptoms are not the flu and are typically short-lived. Misconception 2. Healthy individuals don't need the vaccine. Another prevalent belief is that if you are young and healthy, you don't need to get vaccinated. While it's true that healthy individuals may have a lower risk of severe illness, the flu can still impact anyone. Misconception 3. The flu vaccine isn't effective. Some people doubt the effectiveness of the flu vaccine, often citing that they've still gotten the flu after being vaccinated. It's important to understand that while the vaccine is not 100% effective every year, it still helps reduce the severity of symptoms and the likelihood of hospitalization. The CDC estimates that the flu vaccine can reduce the risk of flu illness by between 40% and 60% during seasons when the virus is well matched. Misconception 4. Natural immunity is better. Another common belief is that getting the flu naturally provides better immunity than vaccination. While it is true that natural infection can lead to immunity, it comes at a cost. The flu can cause severe illness, complications, and even death. Vaccination allows individuals to build immunity without experiencing the potentially dangerous effects of the virus. To sum up, it is critical to debunk these myths about the flu vaccine as we move through flu season. Flu vaccination is an essential, safe, and practical instrument for preserving both individual and societal health. We can urge more individuals to get vaccinated, thereby lowering the incidence of flu and protecting our communities by being aware of the facts and addressing concerns. Let's pledge to practice educated health decision-making during flu season and to vaccinate ourselves and our loved ones. Don't wait until it's too late. Learn why you need the flu vaccine now and take proactive steps to safeguard your health this flu season. Subscribe and share this video with friends and family to spread the word about the importance of flu vaccination. Thank you.